Hello. Dr. David Renz is the Beth K. Smith Missouri Chair in Nonprofit Leadership and Director of the Midwest Center on Nonprofit Leadership at the University of Missouri, Kansas City. And I'm Rob Fischer, a faculty member at the Mandel Center for Nonprofit Organizations and the Mandel School of Applied Social Sciences. Dave and his colleague Robert Herman co-authored Advancing Nonprofit Organizational Effectiveness Research and Theory, 9 Theses, published in Nonprofit Management and Leadership, the quarterly research journal published by the Mandel Center for Nonprofit Organizations at Case Western Reserve University. The article has just received this year's NML Editor's Prize, which is awarded annually for the best scholarly paper published in the journal during the preceding subscription year. Dave, welcome to the Mandel Center and congratulations on this well-deserved recognition.
Thank you.
As a fellow researcher in the field, I'd like to thank you for this contribution. It's a very useful article, provides us a good framework for thinking about issues of nonprofit effectiveness. I look forward to our discussion today. In your paper, you argue for moving away from the notion of best practices towards what you refer to as a set of what we might call promising practices. Now, given the promotion of evidence-based practices in some other fields, what can we in the nonprofit sector do to work towards establishing standards for what practices have merit, and how do you think we can best move the field forward in terms of establishing a knowledge base?
Well, that's a good question and one that I'm not surprised you'd ask. And I have probably a mixed answer. I actually don't think that it works to say something is going to be appropriate for the whole sector. And so one of the problems with the best practice notion is that it implies that something is going to work for everybody in all contexts and all settings. And we know that just isn't true. It doesn't work well. The notion behind promising practices is that there are things that people are trying, innovative strategies and practices that are worth considering, but you need to give some thought to whether or not they make sense in the context you're involved in. I think benchmarking, working with peers and colleague organizations, taking advantage of information from service networks or other groups you're in, provides intelligence and sort of the frame of reference and context that helps with that. The evidence-based question is an interesting one. I've been a little bit frightened and appalled at the recent emergence of this phrase in medicine. I had hoped medicine was evidence-based prior to when it was, I guess. But I think if you were to take that concept literally, evidence-based implies that there is some sort of substantive, rigorous frame of reference or standards or something by which to judge the best practices, and that's the problem. What's being promoted as best practices in our field mostly is something that somebody latched onto in one place at one time, and there isn't a standard there against which it's actually being judged. And so I do sometimes get the question, well, so don't you think anything is best? I mean, shouldn't you be doing an audit or something like that? And my response to that is, if an audit for you is a best practice, heaven help you, because the fact of the matter is there are fundamentals out there that you should be practicing. Fundamentals are not the best practice concept. The best practice is newest, best. It's kind of an infatuation kind of a thing. And what qualifies as best practices isn't consistent across the field now. So I find a lot of imprecision there that gets in the way, frankly. And unfortunately, people who are very influential often use that standard. Foundations and other grantors who are using it to test in some way an agency when in fact they may be asking the agency to do something that doesn't make sense.
Now this raises the issue of the context for many nonprofit organizations. So we have a notion of effectiveness of nonprofit management and approaches that is in a way unstable and transient, so that from year to year an organization that may be high performing and an exemplar in one period may find itself moving down in a subsequent period. So given that flux, how can we make sure that we as nonprofit managers are really staying in tune with those most promising practices that are out there?
I'd say we're all over the map. Part of the challenge is that any generalization about the sector because of its heterogeneity, because of the incredible diversity in organization type, size, setting, all of those things. It's important, I think, to be very careful about making judgments across the whole sector. For that reason, I mentioned a minute ago the idea of benchmarking or connecting with peers and colleagues. I think that people actually are nonprofit leaders, both at the board and particularly at the executive leadership level, are connecting with colleagues increasingly through networks and other vehicles that I would categorize, though they usually wouldn't, as communities of practice. And through those communities of practice, they're sharing information, ideas, they're talking about what they are trying, and that's part of where it comes from. One of the things that I would add in addition, though, is that the whole notion of best practice, promising practices, all of this is very externally induced into the organization. And some of the best and most important stuff we're going to do in our nonprofit organizations is going to come from innovations we develop internally. As our own staff and our leadership groups like boards and other groups really try to make sense of what are the problems, what are the prevailing issues, and not wait for somebody to articulate a practice that should be promising, but to actually try to explore, but then to also participate in venues where you can share what you've been trying.
Also in your paper, you caution against approaches that are, as you say, grounded in an assumption that organizational effectiveness is fundamentally about program effectiveness. So help me with that and help me reconcile the idea that we want to move towards measuring organizational effectiveness, but we're operating in an environment where many funders prefer to invest in individual programs and strategies. So we're forced into program level accountability, but we know that to be sustainable, we have to be about organizational effectiveness. So can you address that seeming conundrum?
That's one of many contradictions in the sector, one of the many paradoxes. I teach Leadership for Public Service as one of the classes, and I've come to describe in shorthand form that public service leadership is essentially about the management of paradox, and I think it's exactly what you just said. To be perfectly blunt, I think we have to be careful not to buckle under when a funder pushes us to simply operate at the program level. But we also have to recognize that most funders are funding us to do what they care to do. They're operationalizing their strategic plan, not ours. So we have to have this larger vision and larger scope. But I think we have to make sure that we as leaders of the organization, whether you're on the board or whether you're an executive director, member of the executive team, we've got to be looking at the organizational frame and trying to help others outside understand it, make sense of it. Frankly, you even have to help your program people do that, because when you're living in a program, you're living the program, so it's just what you know. We're at a stage right now that really is a problem, where we are sub-optimizing the value of our nonprofit organizations at their best, because the fact of the matter is a highly effective nonprofit organization may well need to say, it's time to stop this program and move to a different program. But if you're simply focusing on the program as the unit of analysis, you're not even going to be asking that question, much less processing it from the perspective of an organizational portfolio of programs, given the organization's mission, vision, your long-term strategic direction and goals, which I obviously think are a good idea to pursue. I think you should articulate them, and I think you should be heading toward them. It is a real problem, and it's not just the effectiveness side that you see that conundrum. The fact of the matter is most funders don't want to pay for overhead. They don't want to pay for indirect costs or administrative costs. Somebody's got to pay the light bill, and I think it's hard to do, but one of the things we need to try to do as a sector, so to speak, is to build greater awareness for why it's penny wise and pound foolish to focus only at the program level. Now, I think it's also a problem to focus only at the organizational level. I think we need people who understand that there are multiple levels of analysis, and we need to help people figure out when to operate at each level. One of the things that I hear from a lot of the nonprofit leaders I work with is that they get frustrated when they're demanded to produce outcomes data and outcomes information, because what they think the frame of outcomes will be versus what the different funders who are funding them, usually they have more than one, what they mean, they're all over the map. You know, you've got one group who's saying give us program outcomes, another saying organizational outcomes, yet another saying tell us how this program is achieving community outcomes, which, you know, they're all related, they're not the same thing. And as you may recall in the article, part of what we've made reference to is the fact that increasingly nonprofits in significant service areas are working in networks of service delivery, and that will pose yet another dimension of challenge around that effectiveness and outcome question, because there are going to be network outcomes for which no one organization or program will be able to either take credit or blame for, although they are significantly contributing to what collectively will improve the circumstances of a community if we do this well.
So taking that to the extreme, I recall in the paper you said in the rare case of an organization that is in fact operates a single program, they have it a little bit easier, but they still have organizational features that are not captured in a program logic model or operation. So even they would not have it easy.
Yeah, that's right. And I would encourage them to be very careful about purely thinking of themselves as a single program organization, because unless you've got a really tight niche in the world that you serve, and I think this all goes back to what are the needs of the community and constituents you're serving, you've got to stay in touch with how that environment is changing. And so, you know, if you're fortunate, it may mean adapting and refining the program, but frankly, in a world that changes with the kinds of dynamics and swings we're seeing in some issue areas right now, you know, it may mean a more fundamental change than that frame of reference would allow.
All right, let's turn now to one of your more provocative theses, and that is that nonprofit organizational effectiveness is ultimately a social construction, and rightly so. In your paper, you raise some concerns about the legitimacy that of the effectiveness measures that we choose. Now, you point out that in some cases organizations have hard data that they can link up with certain aspects of effectiveness, and you mention financial condition, fundraising performance, some elements of program outcomes. But for many nonprofits, they are operating in a domain where most of their perhaps most important outcomes are what might be in that softer area, things like collaboration, volunteer management, and leadership. So what advice do you have for organizations that are operating in a domain where they're having to deal with more of those measures that don't lend themselves to the hard data approaches?
Well, frankly, I have the same advice for everyone, because it's not that I think it's, or I should say we, because it's certainly not just my work, it's Bob Herman's and my work. We don't diminish the hard side of it. It's just that when it comes to understanding effectiveness, that's as opposed to individual program performance on specific outcomes, you've got these multiple constituents. They are bringing multiple views to the table. And whether you want to pretend that there's only one right or wrong view, for the most part, isn't going to work for you as a nonprofit organization. You need to stay in touch with the key stakeholders. You can't afford, you know, in the resources and time that you have to be in touch with everybody all the time, of course. But you need to figure out who those key stakeholders are. Presumably they're clients and beneficiaries, as well as some key donors and other key community stakeholders, as you just mentioned. And you need to be in touch with them to know how they're judging effectiveness. Now, I have to tell you, candidly, I find that most boards of directors actually haven't had this conversation among themselves. When I work with boards, sometimes I'll go in and I'll say, I'll just ask them on a scale from 1 to 10, with 10 being wonderful, you know, rate this organization. How great is this organization? Or lousy is the organization? And I find people can give me an answer pretty quickly. They'll 9, 10, 5, whatever. I'm actually not interested in the number. I'm interested in the answer to the next question, which is, all right, now go back and figure out and tell everybody else, what are the criteria that you use to come up with that number quickly? I find most boards haven't even told each other, board members haven't told each other what that answer is and why they've come to that conclusion, much less than thinking about that larger world out there and are we in touch with others out there. We have to decide who those key stakeholders are, and we've got to be thoughtful about that. But it's a complicated factor because that's the nature of our work. That's the nature of public service work, I think. I do think that the other dimension of it, though, is to go back to for a minute to the hard measures. I think we have to recognize that even when you have hard data, it's not going to be interpreted the same way by all these different stakeholders. Now, I don't think you simply toss the information out or ask the question, what do you think effectiveness is, and then pander to people by doing whatever they say or going with their interpretation. The issue is to know what they're thinking, and if you think they're off base, then your job is to help engage them in a dialogue that improves their understanding of what you're doing, why you're doing it, and what you think a more appropriate measure of effectiveness would be.
So I take it from your earlier comment when you suggested that nonprofits are all over the map in regard to the use of promising practices. It's fair to say that organizations are all over the map in terms of ability to use these kinds of measurements as well.
Yeah, that's absolutely true. And unfortunately, while we may not be having that conversation internally, the conversation is going on outside the organization. And it's going on, I mean, to go back to the board example, you know, ironically enough, boards may not have made time in their meetings to have a dialogue about their collective answers. But you and I both know that when board leaders go to a cocktail party or a social event or a football game and talk together about talk about your organization, they're sharing those judgments. The information is being transmitted and acted on. The question is, are we as nonprofit leaders actively engaged in that process?
In the paper, in which you talk about the correlation between measures of organizational responsiveness and organizational effectiveness. And in an environment where organizational responsiveness might be seen as more of a measure of process or satisfaction, how can organizations effectively use responsiveness measures as an interim or an adjunct towards moving towards perhaps their ultimate outcome measures of interest? How do you see organizations using these types of data in an integrated way? And I wonder if you could just say a bit about that, particularly as it relates to those funders who might see responsiveness as a variant of process measurement and maybe, you know, some more akin to satisfaction measure, which may be somewhat out of favor among certain funder groups.
Yeah, that's a good point. I'm not sure that funders necessarily care about a measure of responsiveness except in one key category, which is, are you responsive to them? And that's actually the essence of what we're talking about. The idea here partly is process, but to some extent process turns into outcome as well. And this gets back again to the organizational versus program level. I don't think it's a mistake to ask clients of a given program how well they think they've been served, and that is indeed a process measure. It's a satisfaction measure, and as you and I have both learned in our work, just because the client is satisfied or dissatisfied doesn't mean that it's actually a positive outcome. When students are satisfied with the fact that I've given them all A's, they feel I've been responsive and judicious as well in my test. But the reality is I may not have actually done them or anyone else any favors by having simply given them what they asked for. But we do need to know what that is, and I think the point here goes back to the need to figure out what a constellation or cluster of measures would be and figure out how different stakeholders are interpreting things from that responsiveness perspective. And I don't think you actually go out in a lot of cases, you know, we did in terms of our own actual research tool, but in terms of an organization using the idea, you don't go out and just say, do you think we're responsive? I think you ask a set of questions that in aggregate help you understand to what degree you're perceived as being responsive or not. And it is processy That's the essential nature of effectiveness being socially constructed. It is a process. Social construction is a process. And some people say, well, so then let's look at the hard stuff. But the reality is, it may be a process, but it has hard outcomes, as in people choose to fund you or not, or work with you or not, based on their judgments of your effectiveness. So we can't ignore it.
So this most recent paper, the award-winning paper, followed on an earlier paper, a decade earlier, in which you enumerated 6 theses. And I think it's heartening to see that all those 6 really come forward into the current piece and continue to make a contribution to our understanding of effectiveness and supporting literature. So where do you see your work going over the next decade in terms of monitoring what's going on with the field and making contributions to the knowledge base in terms of organizational effectiveness?
In a sense, it's more of the same, because there's still so much that we need to try to understand. Going back to the point that we were just talking about, if this is a process and it is interactive, then as the operating environment of the organization changes, the way that we deal with these questions and issues is going to have to evolve, and so we've got to keep paying attention. And just as we think we understand effectiveness today, I think it's an interim understanding, because we need to continue to try to get clearer about it, even though there is, as we say again and again, no single objective reality of that's there. Part of what I'd like to think is that we can help people think about the issue that I raised a few minutes ago, which is the multiple levels of effectiveness. In particular, and that was one of the things that we added that frankly wasn't as relevant in the first paper, and it showed up in the last thesis in this one, and that is that as more and more services are offered in networked strategies and initiatives for service delivery, we've got to figure out how to better understand when and how to deal with that, because of course no one organization is, if it's truly a networked system of service delivery, no one organization's assessment of effectiveness is actually going to be all that on target unless they're just lucky. And so then we have the complication of organizations in this network, the actors in the network, trying to figure out collectively how they work together to assess effectiveness in the same kind of environment that we're talking about. And I think it's always a process in that sense, just as the old maxim from Six Sigma, early days of TQM, alleged that this is a journey, not an outcome. It is, because about the time we think we've got stuff nailed, the world, we look around, and the world has changed. It's not the one that we were thinking about when we started.
We've come to the close for today, and I want to thank you for what I will conclude was a very effective interview. We've been talking to Dr. David Renz, whose article, Advancing Organizational Effectiveness, Research and Theory, 9 Theses, has been awarded the Editor's Prize by the editors of Nonprofit Management and Leadership. Thanks for taking time to talk to us today, Dave.
Thank you very much. Pleasure.